This project is really about looking at two different groups of people and comparing them. People that score as food addicts and people that do not, and then looking at different modalities of treatment and really figuring out what's really effective for people with food addiction.
I see this type of research having not only an impact in Nebraska but the country, in that it will bring a light to food addiction and that there are reasons why people eat the way they do.
We're really trying to develop what best practice is. There's not a lot of evidence out there saying if people are food addicted, this is the best treatment.
We're all in this together, and we're right in the middle of it out here in rural Nebraska. This is such an epidemic here that it affects everything and everyone in this battle, from primary care to psychiatry to surgery. Severe weight is a problem, and it's a public health problem, and that rolls over or spills over into everything that we do economically, socially, and so we need to come together as a team and combat this with proven strategies or come up with new strategies. And I feel like this is where we're on the cutting edge of that. We're a part of that, trying to find a new strategy that's going to be successful.
When we started to discuss this project with the other partners, there was so much excitement for what we could potentially bring forth here.
We've been doing projects with UNMC for over 15 years. When Dr. Aguirre and Dr. Creeman reached out to me with the opportunity to help with this study, I was so excited to once again be able to bring the two organizations together. That's what I love about the RFI Nexus, is that it sees how we can all be stronger together.
I'm excited about this project because I feel like we are on the cutting edge of finding answers to some of these really difficult questions, being able to help people in our community who so need the answers that we can find.
The people of this state are deeply affected by this, and so if we can come up with an answer, it may not be the answer, but it will be part of the answer to help combat this. And we're going to make the people of Nebraska healthier, and that's our goal. No matter what we do in surgery or in medicine, we're trying to make everyone healthier.
I'm excited to see how people can get healthy, not just from a physiologic standpoint, but from a mental health standpoint. And I get excited when they're excited, whether they lost 1 pound or 10 pounds, or they just feel better. That's rewarding.